That's exactly it.
I am going to start going through and just asking folks to tell us any updates that you have. And if you got nothing, that's okay too. Chief McKern.
I worked for Lori, and I spent all day. I first yesterday working on reports that she wanted, and the goal here is to keep Lori happy.
And she looks very happy. So, Sheriff Knoll.
Same as Chief McKern. Work for Lori Fleming and report as required. Now, nothing new to report.
I can see that Chief Manley's. I think there's a Mickey Mouse sound coming from your yeah, that. Now try saying something. It's still Mickey Mouse sounding, and I don't know why.
He has it set up that way.
I think he does. Uh-oh.
Oh, he's gonna try to come back in. Okay, Sheriff Knoll, did you say something important there? Because I was very distracted.
No, I just said that I had nothing to report that's new.
Except you're gonna be gone next week.
Sheriff.
What's that?
You made national news. I mean, everybody knows where Port Hadlock is now. I'm telling you, they all know about Port Hadlock and what's going on.
And what was the thing that brought you to the national news?
We had a couple of criminals that were wanted by the FBI that were traveling around the country that ended up in little old Hadlock in a hotel, and the hotel receptionist clerk person recognized them from something and called us, and we staked it out, and the FBI came and they were arrested without incident.
Yay.
Well done.
Nice
Impressive.
job.
Yeah.
I'm gonna walk around with
Didn't even have to shoot anybody.
I'm gonna walk around with a pin that says I know Sheriff Knoll.
Yeah.
Dr. Caudill.
I think the only thing is I'm trying to gather some subject matter experts for the training on June 4th, waiting to hear back from Jim. I think he wanted some of his DCRs to help with that training, so still waiting to hear from him. But other than that, no big updates.
Okay. Let's try Chief Manley.
Is that better?
Yes.
Sometimes it does that when I log in first, so yeah. Okay, good. Well, I too work for Lori, and I need to chat with you. I need a raise just because if I work for you, then I'm going to talk to you about it.
Duly noted.
Yep. And just so you guys know, the community center here in Brennan now has a new person in there, so it is now staffed full time. So they've got that position filled, and yeah, cool. Everything else is good over here.
That makes me think we really do want to get that vending machine going. Jim Novelli may well not be at this meeting because I don't know if you heard, he came down with COVID a second time. Like it was just 3 weeks ago or something that he had it, got done with it, was clear, was about to leave on his on a cruise and tested positive the night before. So he may not be here. Denise.
Denise Banker. I too work for Lori, and the job is to keep Lori happy. And so I do that by behaving and also doing behavioral health stuff in the community. And but I might be remiss on collecting data. But at any rate, we and the community health division over here at Public Health are working really hard on trying to get the counseling back in the school somehow, because we lost our mental health counseling partner in MCS counseling. And so now maybe we can contract directly with MCS counselors, but then there will be some liability insurance issues that will be the counselor's burden rather than MCS's burden. So we have money for counseling in the schools, 3 days, 1 day at each school district on a grant we just got, and then 1 day in the Chimacum School District on funding that we have through the Division of Behavioral Health and Recovery. And so that would be 2 days for Chimacum, 1 day for each of the other schools. And then we also know that the 1/10 of 1% gave the OESD a grant for 1 day in each school district. So that's 2 days in most of them and 1 in 3 in Chimacum. And then the schools themselves are committed to having behavioral health counseling in the schools. And so the days are all kind of up in the air, but it sounds like we're gonna maybe have 4 days per school district per week, which would be fabulous if we can find the certified licensed counselors, right? That was a whole lot, and I maybe said it in a very convoluted way, but it's a very convoluted story. And it looks like Joe has a question.
Yeah, I heard that in a meeting the other day, how MCS had dropped out, but is there any more to that you can share? Or, I mean, are they still in business? Do they just not want to do that? Or
Yeah, they're definitely still in business, and they are willing to supervise these counselors because mental health counselors need to have someone with whom they can do reflective supervision to keep themselves on a sort of even keel. And you probably know that because of the work you do, but they're willing to still be supervisory. But you know, I don't know any of the skinny on any of it. I just know what I was told in the email by Julie.
okay, thanks. Yeah, I
Well,
guess I was.
She has a
curious if
great
they were-
passion for this work, and she's not going to continue it with us. So
Thanks.
Well, I know it's a complicated terrain that everybody's navigating as we think about these, and I'm glad that you're holding the strings as we figure out what to do next. Appreciate that, Denise. Colleen, thank you for pinch hitting for Heidi Matthews. If you'd like to introduce any updates that you'd like to share.
You know, I apologize that I don't have any updates because I literally got, Dan says you need to be there today. And so I kind of got thrown into the mix about, well, you saw it yesterday. So that's kind of where I'm at.
Well, maybe you'll get some insight that you can carry back that will be good insight.
Yeah, and I'm kind of excited because a lot of the parties on here know of me on the EMS side, but I also am the clinic manager for the behavioral health team on the Jefferson side at Jefferson Healthcare. So I work with the social workers, the clinical social workers, and Ann Kuhlman and Carrie Heastand. So kind of excited to be part of this. So, because there's a lot, it's really interesting, like the Narcan Leave at Home that we're doing with the EMS program and the police and stuff like that. A lot of that does not get relayed to the primary care providers and everything else. And it's kind of interesting to me because I think it's such an important piece that all parties know about those things going forward, because we have a good MAT program with Elizabeth Myers. And I think it all just kind of interlinks because if you do have a patient that uses the Narcan and maybe they don't get another Narcan Leave at Home, but the PCP is willing to write a prescription and help them out, or we can, refer them to another, the program to Leave at Home that I think you guys did a Saturday before last or something. But the primary care providers don't know about that. I think it's important. So I like this. This is great. And I'm really excited that I can be a part of it. So thank you.
Well, thank you for being here. Of course, one of the things we're always interested in when we get a Jefferson Healthcare representative is to have insights around what's happening with the clinic there down in Quilcene. We'll jump into that a little bit later. Holly, I'm glad you could make it.
Oh, forgive my tardiness.
Oh no. Anything new that you'd like to talk about on your front?
Well, was the drug take back event touched on already?
It was at the last meeting. Oh, that reminds me, I was gonna put the link for the notes and all in the chat. Thank you for reminding me.
Gotcha.
I know that you have upcoming, it seems like you have maybe there's an event on May 20th.
Yes, this Friday, we're having, it's gone through a couple iterations of the name. It was initially Show Us Your Community, but now it's the Quilcene Resource Fair at the Quilcene High School gym multipurpose room this Friday from 4:30 to 6:30. There's still spots if you'd like to, have a table for your organization, bring some handouts, or just have a person to be on site, networking with community members, students, things like that. There's also going to be a repair event, which is sponsored through the Port Townsend Marine Science Center in an effort to reduce waste and landfill things. So if you've got a toaster or a bicycle that needs some minor, engineering fixes, you can bring it with you and learn some new skills and keep things out of the dump.
Great. Well, it sounds like there's a lot going on there. Anya?
Hi, sorry I was late as well. It sounds like you gave the update about the drug take back event, and I'm planning on being at the event Friday that Holly was just speaking about, the Show Us Your Community resource fair, and doing some more education. So grateful to be here. Thank you.
Well, in a way, it feels like South County is leading our whole engagement and education and awareness. So really kudos to everybody who's doing all of that work in this arena. Gabbie, I know you're new to the table, but you're going to be so featured. Anything you'd like to?
Yay. I don't have anything. I'm sure we're going to discuss a lot of things here shortly. So I don't have any new information other than that.
And you're feeling okay? Has the car gotten through the insurance?
I hit a bear, not last night, but the night before. My car is not okay. My neck is sore, but other than that, I'm fine.
Well, you sound wonderfully coherent. So
what are the odds?
What are the odds? Yes.
Yeah.
And then I see Greg Brotherton has joined us. Is he available? He might be. Or maybe he hasn't. Okay. I am going to go ahead and throw up a slide that just has some of the discussion topics that this group thought about as we looked at the potential for a mobile harm reduction unit. Oh, good. There's Greg Brotherton. Greg, was there any updates or anything you wanted to give before we hop into?
No specific updates. I'll tell. Well, I was late because we were choosing the public artists to make proposals for the Seventh Haven Affordable Housing Complex. So doing our final selection, got some great local artists that are going to make pitches. But sorry I'm late.
Greg has all the fun tasks.
I try.
All right, sharing my screen quickly. Gabbie and Believe in Recovery will be partnering, or is looking at partnering with OPHS to bring mobile harm reduction services into many areas, South County among them. And it seemed like it'd be a great idea to bring her to this table to have a chance to talk with you guys and have a conversation about what that might look like and answer any questions you guys have and think about any things that maybe we should be doing in advance that would be useful and make this a successful approach. So I've thrown up on the screen some of the questions that we talked about. And I don't know if Gabbie, you want to just sort of give us an overview of the program to begin with, and then maybe folks can come back to this and we'll have sort of an organic discussion going from there.
Sure. So Believe in Recovery acquired a 29-foot RV that we have remodeled into a mobile SUD clinic. With that, we've applied to the Department of Health, and that clinic will be able to provide all of the services that we're able to provide in office. So with that, assessments, peer support services, up to intensive outpatient services, anything in between that we're able to provide, we will be also able to provide on the mobile unit. My plan right now is to send out 2 of our SUD counselors and our peer support specialists, along with a case manager, and send them out so that they can provide field-based services in the mobile unit. We did partner with OPHS. They are able to provide inductions to MAT services and also just ongoing maintenance for those. So they'll be going out with us 1 time a week in person, and then they're available via telehealth throughout the rest of the week. Our plan right now is to drive down 101, go out to the coast, and then come back. And so what that looks like for us is stopping places along the way. So we've compiled a pretty big list of places, such as community centers, fire departments, places like that, just pulling it into parking lots. So right now, we've compiled the list. We're going to start calling people next week to try to get meetings with whoever's in charge at those places to find out about what it would look like for us to park in their parking lot, because I know there's some liability with people in their parking lots and stuff too. So I've got that done, and like I said, we'll start compiling or calling the people that are on that list next week to meet with them. Other than that, it's been a big remodeling an RV is not fun.
A good bit of work.
Can I ask a question about it, Gabbie? I'm
Yes, sir.
curious. So it sounds kind of like, for lack of a better word, a smile mobile model where you've got pre-scheduled stops, you know,
Correct.
with the Quilty Community Center, Brennan Community Center. And I think that's great and really expands access. I'm wondering if you're thinking all about being able to be responsive to like the real navigators, or someone saying, hey, you know, we've got an issue here that we could really, you know, use the SUD mobile, whatever you're going to call it, to come out and responsive to like emergencies or acute situations. Is that possible? Or I don't know the logistics of this, of course.
So we are licensed to provide emergency services, which is a 24-hour service. So we currently go out with, we get called out quite a bit by law enforcement. Most of the time, it's just a conversation that we end up having with somebody. We don't ever like, you're going to detox right now. It's 11:30 p.m. Let's go. And we do work with the real navigators as well. I do spend quite a bit of my day not in my office. I'm out in the field, or I'm out making connections with people, or I'm in the jail, or whatever that looks like. And we do have so many people in the Quilcene Brennan area that start services and then can't, for transportation reasons, continue services. And so it'll be good to have them provided with services. And our peer support specialist does quite a bit of the case management stuff here as well. And so a lot of those people will get wraparound services.
Sheriff Noel, I see your hand is up.
Yeah, I was curious how, if I was a person that had substance abuse issues and I lived down in Quilcene, let's say, how would I take advantage of this? Am I thinking of it the right way?
You're wondering how you would connect with the service?
Yeah, I mean, I'm just living there. I don't know. I mean, is it like, you say it parks in a parking lot or something, and then, I mean, would I just walk up and go, hey, what are you guys doing? Or would someone come save me? You know, I don't know if that's a fair question or not, but I was just curious how it would work for the person out there on the street, I guess, that nobody knows about.
Love to save people in the woods, Joe. I think walk-up services are great. Our RV is large enough that there's like a separate room. So if somebody were to walk up, we can take them in the back room. And I think that with what we're able to do in terms of having a scheduled stop, and people will see the RV. We're getting it wrapped, so it will be known that it's not just a RV in a parking lot. It'll be known that it's Believe in Recovery. And you'd be surprised how many people know we exist. But so I think just being out there and people knowing like, hey, on Mondays, Wednesdays, and Fridays, they are in this spot from noon to 3. Having set schedules of being where we're at is really important for both my staff and scheduling, as well as the community, just so they have, we can definitely go during this time, and here's the services that they can provide. And then word of mouth, I think, is pretty important too. And, just continuing to provide outreach services. I mean, we've gone out in Quilcene before. It's not like we've never been out there. And so a lot of the people know that we are doing this and it's coming.
Would there be any kind of follow-up, with people, or they didn't, I don't know, they don't show up, they come 3 times every time you're there, then they don't show up? Would they by then be involved somehow with you would know where they live, or you know what I mean, to say, wonder where Joe's at today?
Try not to show up at people's houses unannounced.
Yeah.
But generally there is some sort of follow-up, and like I said, a lot of the field-based outreach that we do is just a conversation. It's not like, hey, you need to be in treatment today. It's more like, hey, what's going on? Haven't seen you in a little bit. What can we do to get you back in services? What's going on? Do you need a higher level of care? A lot of times when people stop showing up, it's because they've gone back to using. And so just being able to really meet them where they're at and provide them the best services we can is important. And, sometimes that's referring them to a higher level of care.
I'm curious what services will be available. So will it mostly be like SUD counseling and that kind of treatment services, or will there be like syringe or MAT, or like, testing for Hep C and HIV and things like that?
So OPHS is going to be providing the MAT services.
Awesome.
And so they, just like in the office, won't have any Suboxone or anything on the mobile unit, but we'll be able to provide prescriptions. We do kind of, I'm not sure the pharmacies in Quilcene, are there any? I don't know, but we do work pretty close with Tri-Area in Port Hadlock, and we'll be able to provide transportation for people to get their medication, just like we do here in the office now. We take people out there pretty regularly to pick up their prescriptions. As far as SUD counseling goes, we provide assessments, DUI assessments, relapse prevention or level 1 care. We provide intensive outpatient, which is level 2 care. And then we also have a clothing closet where we provide clothes for people, toiletries, etc. Anything kind of that people need, we're able to provide that. We are able to provide information and crisis services. So if somebody calls at 1 o'clock in the morning and they're like, hey, my dad's really intoxicated right now, what do I do in this situation? We kind of just talk them through it and what that looks like. Anytime we get calls like that, we follow up the next morning too, and just after we've walked them through the immediate crisis situation that they have, we follow up with them the next morning. Anything that we can provide them or help services that we can provide, we do. We do have naloxone, and then OPHS is also able to provide prescriptions for that to people that are interested in that. We as a behavioral health agency just have some on hand. I know that the Needle Exchange had talked at some point about partnering. I don't know what that would look like, but I'm happy to pursue that. And I think, being able just to provide people with the services that they need and want, I think is important. And I think that's a huge piece of harm reduction, is being able to provide those supplies for people without judgment. And I think, well, I'm willing to definitely look at that.
And I would say, Gabbie, as you move forward and we move forward, hopefully with some like naloxone vending machines, that co-locating at those locations for you guys seems like it makes a lot of sense.
Yes.
I was curious if you have OPHS with you, I think you said that you could not provide Suboxone how come you didn't have how come people couldn't come there to get their Suboxone?
They can get a prescription, but they're not a pharmacy. Just like
So when someone goes to OPHS, I thought they went in and got Suboxone when they went.
they get a prescription, just like going to your doctor. You don't go in and get a prescription for whatever, an inhaler. You go to the doctor, you get the prescription, and then you go to the pharmacy and fill it.
I always
And
thought
so
they went there to get their injection or whatever it was. So they just get
they can get a Vivitrol injection. However, they have to get a prescription. They have to get the Vivitrol injection from the pharmacy, and then they take it back to OPHS where they get their injection.
So if they had a prescription, could they do that? I mean, I guess I was trying to think of a way that they could do it without having to go to Hadlock or Port Townsend.
Yeah, I mean, because you're considered a dispensary if you're supplying the medication and everything else. And that's why you have to get the actual drug. The same thing works in the clinical areas, like Dr. Erickson supplies it. Certain patients, because of their insurance, have to pick it up at the pharmacy, bring it to him, and he gives the injection or the pellets or you know, if it's filled
Never
in
knew
a pouch
that.
or whatever
Could
else.
could they give their own injection at home if they wanted?
It depends on where the patient is in their treatment, and there are some very stable self-treatable patients that are on naloxone, but it's not very many. I think it's, you know, if they're in a very good place and on it for a long standing, but most of the patients, you know, when they're starting up. The other thing is that you want to watch them for, you know, you want to be there for them when they're having that, you know, coming down, because at least with what we've seen in the clinics is that when Dr. Erickson has done the induction, you know, do they need that? A lot of times they need the second dose of the Vivitrol or whatever else, because the cravings or whatever else is so strong that he has to manage that. And so we don't do a lot of home inductions until the patient is ready, because we want to be able to monitor them. They're sick, they're, you know, they I mean, you guys know, you guys are experts, but you know, they're you know, cold, clammy, or then hot and sweaty, and you know, you just want to be able to manage them so that they don't relapse. You want to walk them through that. So I think that's part of it. So yeah, it's having that prescription. And the reason we can leave it at home is because we have a grant, you know, that's allowing us to have the drugs and be able to leave them at home. And we're not being a dispensary. It's we already have the product and we can just give it. When you deal with certain agencies, you lose that and you become a dispensary otherwise.
And also Vivitrol is a shot in the butt. So it's very hard to give yourself an injection in your backside.
Holly, I saw that you had your hand up. Did you still have a question?
It was part question and part observation. It's just the general lack of pharmacy services south of Chimacum Port Hadlock has been it's been a very loud thing. And this is such a wonderful service. But when lack of transportation is such an issue for so many, it feels like it's only 70% of the solution. If you can get the piece of paper, but you can't get the medication, you know, it feels like folks are going to be stuck again. I would love a mobile pharmacy, even if it was one day a week. A couple months ago, one of the clinicians at the student-based health center had a student that needed antibiotics like yesterday. And she jumped through so many hoops to make sure he got that medication. But it was one of those things where, you know, it took way longer to get him treated than it should have been. And that's just for, you know, something as, it's not a benign thing, but, you know, antibiotic or infections go from bad to worse so quick. But that's been a big piece on my mind, is the pharmacy.
Thank you, Holly. Dr. Caldwell?
Yeah, I was just wondering if, you know, I'm hearing everyone reflect on the desire to have people begin treatment, right? To have a small win so they feel good about their experience. And I know the Tacoma Fire Department, their CARES unit will initiate treatment on the scene. They have a nurse-based CARES unit. And I wonder if there's opportunity to partner with either EMS or, you know, someone who does, who's sort of certified to do that stuff. And I don't know if you've explored that option. I'm sure there must be other places. I think Bellingham is pretty progressive, and I think Spokane also. I don't know if you've explored what it
I'm
would.
actually on the CARES team in Paulsbo with their fire department. So I've talked a little bit with Jake over there, who oversees the CARES unit. And I've also talked to Chief Black in the past about the potential of having a CARES unit over here. I think that would be an amazing thing to have for sure. And I'm definitely looking at our options in that regard. And I think that would be so amazing.
You might be on mute.
My observation has been that funding is the challenge, and maybe if you get this grant, if you could provide some funding, that might break down some barriers.
Sign me up.
So just to recap, to make sure I've tracked properly, we can get the prescription out. Gabbie could arrange for transportation on some regular basis so that folks can get their prescriptions filled, but we are not going to be able to intercept somebody at the community center and induct them there. Is that true?
So they can be inducted, but again, they would have a prescription that they need to go fill. And as long as the pharmacy is open, if somebody is ready to get an induction onto a MAP program, 100%, I will always do exactly everything I can to get that person to where they can get their medication. And, you know, same thing we do here in the office. I have somebody on staff who transports people pretty regularly to pick up their prescriptions. And and I don't see this any different because it's so important and there's nothing out there, nothing.
Right, right. Sheriff?
Yeah, sorry to keep dragging this on, but now that I understand it a little more better, so what would it, how many days a week and would this be?
Right now, I'm planning on going out 5 days a week. And as I expand the hours and days that we're open in our office, my plan is to expand that into the field as well. And so it's
And
just
then
a matter of time. I mean,
it's, I'm sorry, it's to go from, like, let's just say you drive down to Brennan and then you work your way west. Is that what you said? You would go out to the west end. That would be one day of work.
Yeah, that's my plan. My
Yeah.
plan is to be out there every day that I can be. And like Dr. Carl Baum said, it's kind of a matter of funding. And so with people, if they're on Apple Health, we can bill Apple Health for their session. If they are not on Apple Health, we can get them signed up for Apple Health very quickly. And so that piece of it would be covered. But that doesn't pay for gas and all the stuff that it takes to get out there. So we have applied for a grant in partnership with OLICAP. And that would fund, should we get the grant, that would fund the gas and staff time that it would take to fully have a program where we are going out to the West End every day. And so in that, we would stop along the way, Quilcene, Brennan, wherever else.
No, that makes
I
me
mean,
think.
going out to the,
Oh.
sorry, go ahead, Joe.
When you mention insurance, what if someone didn't have any insurance or anything? Would you have money to see them?
We have a sliding scale, and we have other grant opportunities for people who are uninsured or underinsured. So I have never in the last 10 years turned somebody away because they don't have funding to pay for something.
I think I knew that. And I was just, yeah, I mean, just being involved with this stuff as we all are, I don't know. I'm always just surprised about how insurance or lack thereof gets in the way of things when it shouldn't. So I'll just leave it at that. Thanks.
Yeah. It's
Dr. Caudill?
unfortunate.
Yeah, Gabby, how have you sort of engaged the community to make sure, either with a needs assessment or with information, like, are people excited about this? Are they going to be receptive, not receptive? Do you have a sense?
I don't have a sense. The only risk assessment I've done is using the information that has already been gained and the fact that there's no services out there. Just in a brief assessment of my clients over the last even 5 years has been a 74% rate of people who stop coming to treatment because of the lack of transportation from Brennan or Quilcene. And that just got worse with COVID and the lack of public transportation, even from that area into town. It got a little bit better being able to provide telehealth services, but there's a lot of people that don't have good internet out there and can't get on Zoom. There's a lot of people that just can't do it. And, sitting on these meetings gets tiring. And when you're doing it for intensive outpatient and you're on a Zoom session for 2 hours a day, 3 times a week, plus going to AA meetings, plus all this other stuff, it gets tiring for a lot of people who are struggling. And so I've just seen such a huge decrease in the amount of people that complete treatment from that area. That's kind of where this whole thing developed, is we need to bring services there. As far as the people that I've spoke to in that area that I'm like, hey, we're going to be doing this, everybody's been pretty excited about it.
Commissioner?
Yeah, thanks. Whoops, sorry. A comment, I guess, and a question. The question is, how is staffing? I mean, are you doubling your staffing to stand up this program? And the comment is just, there's 5 times as many people in Brennan as there are on the West End. So you might not want to make it a daily circuit, but, think about population or client populations in the different areas, because, it's a lot of driving to get out to the West End for, 250 residents that live there, and a lot of gas and all that. So, but yeah,
Yes.
the question is, how's staffing going?
Staffing is pretty intense. I've, in the last 2 years, went from 4 staff members to 15. The amount of people that are struggling has gone up significantly. And we are always hiring. And I think that with the services that we can provide now, with having peer support, so certified peer counselors, has really changed how we are able to hire people, which I'm excited about, because now we can do that. And so that's been exciting. As far as putting people out there right now, I'm putting, my plan is to put 2 SUD counselors and a peer support specialist, which would also be able to do case management stuff. And so having those 3 people, one of them used to be a driver, so now he's going to be driving this, which he's really excited about, let me tell you. But he is going to do it. So just having 3 people out there my plan is to have a male and a female counselor. We'll also be able to provide UAs out there because we do have a bathroom on site, and so they will be able to supervise UAs just like we do here in the office. And then that's our plan right now, and they're pretty excited about it.
It's great, really exciting.
Yeah.
Sheriff Knoll? Sheriff Knoll?
Yeah, I don't know if Gabbie, if you've heard this or anyone else in the group here, but has there been any like negative stuff like that? I don't know. I'm thinking of like up in Sequim and Port Angeles with the methadone treatments. I mean, is there anyone saying not my town? You know, has anyone encountered any of that or heard any negativity onto it?
I haven't, and I think just because we're showing up for a couple hours and then taking off, I mean, it's not. I think the concern in Sequim was a lot of people get shipped to other places for methadone maintenance, and I think that's where that not my town came in.
Yeah, and I haven't heard any scuttlebutt about it or anything.
Everybody loves me, Joe.
Yeah.
Chief McCurran, Chief Manley, thinking about it from Brennan and Quilstein's perspective, is there any thoughts from where you're sitting about what could be done to make sure the community is aware and we've given folks a chance to sort of interact with the idea before showing up and possibly, you know, encountering resistance that we could have avoided if we just introduced it properly?
So to answer for Brennan, we have both a pretty big presence on social media, so that would be a good way to go. Our Brennan community page, our fire department page. So, and that's what I would suggest. Community center.
Mm-hmm.
What else?
And I seem to remember you had a.
Oh, and we also have a local newspaper as well.
Mm-hmm.
For now.
So
Okay.
if you were thinking about any talking point that would resonate with the community there, is there something that comes to mind?
For us, I would just say that the services that are available, just letting people know that it's there, that I think is the most important thing.
Okay.
Yeah, I mean, we pass out a lot of those cards and stuff to people that we feel we need. We leave stuff behind. So yeah. I think it's
Gabbie,
more of an education than anything.
do I have it right? You'd actually have naloxone on board. We could also say, you know, if you want to pick up a life-saving blah, 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 this would also be a point that you could do that and be right in town.
Yeah.
Yeah. Chief McCurran, how about from your perspective, anything?
Well, I think, Gabbie, if you want a time and a place, I think Wednesday mornings at our senior center, I think everybody comes out of the woodwork and comes to, they've got their kind of, I'll call it the food bank issue, and usually the line is halfway down 101. So definitely you're gonna get an outreach out there. And I believe the same thing occurs on the Caudill on Tuesday. I hate to say there's a community of the Caudill, but there is a community of the Caudill. And there are a lot of folks out there, and the folks that are out there have a reason for being as far out as they are. So don't forget the Caudill folks. Doesn't mean it has to be a weekly thing, but probably once a month wouldn't hurt to get out there and chat with the folks at Caudill. And same thing down here where they have the food bank on Wednesday mornings are good. Certainly, we'll open our parking lot up for you if we've got plenty of room. So if you're interested and you want to set up a day, why certainly let us know. And the parking lot's open. Obviously, you're familiar with the drug take back program and the Narcan work well in our parking lot. So obviously they know the community comes and looks and knows what's going on. So thank you for doing it. We appreciate it, Gabbie.
Yeah, I'm excited.
And Anya, I saw you had a comment.
Just that I think that access is the talking point, because these aren't new services. This isn't like this isn't enabling people. This is bringing a service that's already accessible to folks who are more in more of the denser populated areas in our county. So it's nothing new. We're just being more inclusive of South County with the services that the county already has. Whereas like with the MAT clinic, that was methadone on the peninsula was new. So I think it is different than that. And I don't think there'll be as much pushback.
Mhm.
Yeah, and I guess I look at it too as right or wrong, that if people do question it, I mean, it like you say, it's nothing new. And these, the people that would use the services, they're already there. And it just makes it, if nothing else, makes the public more aware. I think kind of like with mental health and whatnot, that, that there's really people in our communities that need these services. And it just makes it more in your face, kind of, it's going to make people have to think about it and maybe do something to help out. So yeah, I'm excited to see how it works. And I keep thinking of it like the bookmobile, and I think it'll be cool.
I used to love the bookmobile when I was a kid.
I
Okay,
can still remember going through the doors of the bookmobile. I don't know why I remember that, but
me too. The smell of it, the
it was a
excitement.
good, yeah, it was a good secure feeling. I don't know why.
Okay, other thoughts on that topic? Gabbie, I really appreciate you coming and just opening up to the conversation. Holly?
Yeah, just a final thought. I watched a webinar recently on a harm reduction strategy they're employing out in Pierce County, where I'm not advocating for this right now, but they were, it's not exactly a legal strategy, but it's what they were choosing to do is bring clean smoking materials to individuals who are actively, smoking opiates or amphetamines. And one of the unintended side effects they noticed were a lot of people were reporting that having access to the services where it came to them, as well as having their own tools, was empowering in their recovery journey when they actually got there. Because sometimes, it tends to be women, but not always, is like transportation, and those resources are an instrument of like power and oppression. And so if perhaps you're in a relationship where there's a power imbalance, if that's withheld, then nobody's going to get better. But by having access to those services on your own schedule and on your own of your own choice, there was a lot more folks that decided to either embark in an abstinence type program sooner than they thought they would if they had stayed or without that tool.
Without the tool. Mhm. Thanks.
I've seen a lot of the safe smoking supply stuff as well. And I think it's an interesting new harm reduction thing. And like I said, it's along with the safe or clean syringes. I think it's a good thing to explore, because as much as I love recovery, not everybody wants to be sober. And so I think just making sure that people are safe when they're using is pretty important too.
I guess I was trying to speak more of the surviving of abusive relationships too, in that piece.
Yeah.
And I think folks can have different definitions of recovery. And for maybe some folks, like stopping using hypodermic needles and smoking would be one step toward recovery. And we know that with when we're providing pipes, folks also have a less higher chance of like sepsis and wound infections, hepatitis C and HIV as well. So I'm all for, including clean pipes in our in the supplies that we can offer, and would love to find ways to fund that and to educate folks about how that's really harm reduction work.
Yeah, I think it's a good idea. I mean, I think it's like what Holly said, it does empower people to make their own decisions, and sometimes making that decision to have their own supplies can make a big difference in their life. And yeah, everything's baby steps.
Right. Thank you, Holly. Yes, that switching from the one mode to the next is a step. It's a step in the right direction. Other thoughts? Small wins to bigger wins, yes. Sheriff Noel?
Sorry, maybe you already said this, but when's the first run, or do you know yet?
We don't know. We're waiting to hear back from Department of Health. Shocker, they're slow right now. And so as soon as it comes through, we're trying to get going as soon as possible. the remodel is pretty much done. The only thing we have left to do is wrap it, and then get going. And as soon as that happens, I do plan to go to some places once we get those meetings set up with people, just so they can see the RV, check it out, know what's coming, and kind of do like an open house before we actually start providing those services out there.
Gabbie, would it be helpful if we connected you with, I'm sure when I say we, I'm thinking it's Denise, connected with public health here, Jefferson County Public Health, just to think about what does a syringe exchange look like? How is there any collaboration that might be useful between those two places? Same with the safe smoking supplies. I know I've run that up the flagpole at the BHC, and it wasn't a unanimous decision to go with safe smoking supplies. And I've kind of been sitting back trying to decide how I feel about going forward if I don't have, sort of the thumbs up from everybody. So that's something I'm still thinking about. And so the BHC hasn't funded public health as yet for those safe smoking supplies, but I'm not saying it's off the table at the moment. I need to think about how to engage everybody else in the way that we talk about engaging, the folks who we're trying to bring closer along in their recovery journey. I feel like it's the same process that we kind of need to approach any community, that we don't insist that our way is the only way. And so that table is a place where I'm trying to use that same theory, because collaboration at the consortium table is really the only way we get everything done. And I don't want it to end up being pushed off into polarized perspectives about it. So back to the original point, could I connect you up with somebody at public health, or could Denise connect you to sort of further those conversations? And I'm not saying you need to have that on board in order to get started. It's just
Absolutely. And like I said, I'm happy to explore that opportunity. And, I'm fully aware that not everybody wants to get sober, so they should be safe at least. And so, yeah, sign me up.
Okay. All right. We'll check in with Denise. Okay, I know we only have 4 minutes. Did anybody, it's rare that we have somebody from Jefferson Healthcare here. Were there any comments, questions, insights that anybody would like to relay or ask of Colleen?
I will tell you, sorry, I'm going to butt in, but I will tell you that we're still diligently looking for an ARNP or an MD even to fulfill the role down at South County. And we really thought we had a good provider, and then he backed out of the contract down there. The problem is that we really need a strong, not out of school, standalone provider like Marilee was for so long, that can, sorry to say it, but the clients down in South County are very, very sick. And when they do come to the clinic, they haven't taken their warfarin ever or whatever, and they can be really sick. And so we need a standalone. I know Candace Byers is working down there on Mondays, and then Dr. Kirshner is also working down there. Now we're up against Candace Fry-Taylor, who was the office coordinator there. She just retired a week and a half ago. So now we have no staff as well. And then the MA also quit. So when we do have a provider down there, we're kind of hodgepodging. Jefferson Healthcare has over 100 positions open currently that we're looking. I mean, I'm not talking anything new to anybody here on this line. And OMC has 172 positions open. So it's just a matter of looking. So we are diligently looking for the right provider to be out there. We don't seem to have a problem getting PAs and ARMPs here at Jefferson within the clinics here, but for some reason down remotely, I think it makes sometimes, I don't want to say a mid-level, but it makes some people not as comfortable. So that's kind of where we're at with the recruiting process, but I know HR is really, really working hard to find somebody out there.
Thank you, Colleen. Chief McCurd?
I don't have anything. Colleen answered everything.
Okay,
Colleen and I talk frequently, so I think we're on the same page. Is that we certainly, I agree with her. I have to echo what she said. The patients that we pick up in the clinic, they're sick, and usually they've walked in about 2 minutes beforehand, and they do a good assessment to say, you know, sick, not sick, determine it's sick, and away we go with them. And so that's kudos to those folks. And boy, my heart goes out to you to try to find some folks. Every time we think we have a warm body and things are going to work really good. But I will tell you, the folks, you know, the talk around the post office folks, you know, we see the post office folks every morning when we get our mail, and they want providers down here so bad. You could not, they are just screaming for providers down here. So anything we can do in the community to help, let us know. We'll try to send providers your way.
I nominate Dr. Carl Baum.
I second that.
Come move to the country and live in a little cabin down in Quilcene.
I will say, Colleen, I really appreciate having somebody here from Jefferson Healthcare. If there was any way that, you know, even you could become a regular, because it's just good to have a face here, to know that somebody there has heard what's going on at this table. That would be very useful. I know
Well,
this would appreciate
I'm
it.
happy to be here. If you want to input that to Dan or Jake, that's fine. I'm more than
Okay.
happy to be here.
All right, we'll see if we can facilitate that. Okay, any other thoughts? I know everybody has to run to the next meeting, and I apologize. I took you right up to the 2 o'clock mark. Okay, go forth. Be wonderful. Bye-bye.